Hi guys, this is Dr. Bailey. I'm a board certified orthodontist and the co-founder of TrayMinder, an aligner tracker app. So today I want to talk to you about retainers. A lot of my patients are finishing clear aligners and they're moving on to retainers. And actually a lot of them are shocked to hear when I tell them that they have to wear their retainers full time for the first 4 months to a year and then nighttime indefinitely. They're shocked. Why do I have to wear my retainers forever? Well, it's like this. If you've had to work out in order to get into the best shape of your life, can you just go back to not exercising or eating chocolate cake for dinner? You can't, right? So your teeth are the same. It's just like lifestyle maintenance. When you take a shower today, you still have to take a shower tomorrow. You dye your hair today, I don't know, three months later, you have to dye your hair again. So let's first talk about the different types of retainers that you can have. The first most common type is the old school Hawley retainer. They look like this. It's a clear plastic, all right, and there's a wire in the front. This one is called a wrap retainer because the wire wraps all the way to the very back. And the clear part of the plastic or acrylic, you can choose whatever color or designs that you like. And I went with the clear pink because it's the most inconspicuous and it matches my gums and my soft tissue of my mouth. So what's good about Hawley retainers is that they're long lasting. I've had mine for 10 years and they're still in good shape. I take very good care of them. I clean them. And so they do last a very long time. Also, I can adjust them slightly if I get a filling or I get a crown. Usually that the acrylic part of it can be adjusted to some extent, so it does last a long time. The con of having a Hawley retainer is that they don't hold your teeth as well as with something that's full coverage like an Essix retainer or a Vivera retainer or True-Tain, one of the clear varieties that you'll see. So because of that, your teeth can shift a little bit more. And that's a plus as well as a minus. Because they don't cover the biting surface of your teeth, they allow your back teeth or your molars to settle more. So if you ended up with a little bit of a posterior open bite, that not having a full coverage on your Hawley retainer allows your back teeth to settle toward each other and you get a little better settling with that. However, the con is that it also doesn't protect your front teeth from shifting in an upward or downward position. And so you can get some incisal unevenness, meaning that your front teeth, if they decide to shift, your Hawley retainer isn't really going to protect your front teeth from moving downwards or upward or whatnot. So that's one con of having the Hawley retainer. Then of course the second most common, it's I guess more common now for clear aligner users, is to go with something that's clear like this. What's nice is that it's more comfortable, you lisp a little bit less. If you're already using clear aligners to correct your bite and to correct your alignment, you're already used to it. So just switching to something like this is a very smooth transition. It doesn't take a lot of adjustment. What you might find is that the material is a little stiffer and the material may be a little bit thicker. So that's really the only adjustment that you may have to make in going from your clear aligners to Essix retainer. It's also lighter, it adapts well to your teeth, it protects your teeth from moving in all directions, and that's I guess a pro as well as a con, right? So if you have some posterior open bite, your teeth will settle once you start wearing your aligners at nighttime. So it does happen. Another good thing about Essix retainers is for my teen patients that have late eruption of their 12-year-old molars. Sometimes I get 17, 18-year-old patients and their upper second molars, the 12-year-old molars, aren't fully erupted yet, but their bottom ones are. So I like to have full coverage clear retainer to help to cover the back second molars to prevent them from super erupting or growing too tall to try to find its opposing partner. So I guess the bad thing about clear aligners or clear retainers is that they don't last as long, of course, because they're thinner, right? So they're not going to last as long as a Hawley retainer, but that's good and it's bad, right? So if the reason why they don't last as long is because they're thinner, but they're also more comfortable. The reason why they don't last as long is because some people grind, they brux at night, bruxism, and they wear out their retainers faster. But hey, you know, wouldn't you rather grind out your retainer than your actual enamel? So that's a no-brainer. So if you are grinding your teeth and you don't want to get a night guard, then this might be a good option for you, even though you have to replace them more often, but at least they're protecting your teeth, right? You're not grinding down your teeth. And furthermore, I mean, these are like contact lenses, right? And these are like your glasses. These are going to last longer. They're bulkier. They cost you less. These are contacts. They're more comfortable. They're more aesthetic. You have to replace them more often. They cost you a little bit more. So there isn't a right or a wrong. There are pros and cons to each. But you know, pick the one that you want. Am I going to cry over the fact that I have to replace my shoes every so often? No, because number one, I don't want to wear out the soles of my feet, and I don't want to wear the same pair of shoes for too long. They get stinky and gross, right? So now let's talk about fixed retainers. Fixed retainers are glued to the inside of your bottom teeth usually. So they usually go right here, okay? And fixed retainers are great for people that started off with a lot of crowding or rotations, because remember that your teeth will have memory and they have a tendency to rebound back to where they were. So if you don't think you can be 100% compliant with wearing your retainers, getting a fixed retainer might be a good option for you. It's glued onto your front 6 teeth, and it just, you know, stays there. They call it permanent retainer. I don't really like to use the word permanent because nothing is truly permanent, right? I call it a fixed retainer. Permanent retainers, you know, I don't love that term, because remember, you're using glue to glue little dots of glue, and it attaches your fixed retainer to your teeth. And let's be honest, there's nothing that will last permanently forever in an environment that's 100% moist at all times. So, you know, there are people who have had their fixed retainers for over 10 years, and there are some that will only have it for a year. It really depends on a lot of factors, you know, one being, you know, how tough you are on your fixed retainer. If you're chomping on ice and eating lots of hard foods, or if you are flossing and you're tugging and pulling on your fixed retainer, that's really going to weaken the glue and make your fixed retainer last for a shorter period of time. So of course, the pros of having a fixed retainer is that it's set it and forget it. It's on, you don't have to worry about wearing your lower retainer. But however, most orthodontists like myself, I don't really love putting fixed retainers on the top, and that's because of the increased rate of breakage. Let's think about this. If you have fixed retainer on the inside of your front teeth, every time you bite into an apple, your bottom teeth will push the apple into that area. That action on a daily basis will weaken the fixed retainer, causing it to fail or causing it to come loose. I do put fixed retainers on the top, but usually for severe rotations of the upper incisors, or if there's a large diastema or gap that was present before orthodontic treatment. Okay, now one thing you have to think about is that with freedom comes responsibility. So with fixed retainers, yes, you get some freedom, but you have to floss your teeth in a more complicated manner, right? So you can't floss straight down because that fixed retainer is there, but you can use a threader floss. So there's a threader that you can buy and you thread floss through it, and you have to floss under the bar so that you can clean in between your teeth. Or you can use what's called a super floss, which is a threader and floss in one. So yes, there's a little extra bit of care that you have to do, and if you don't floss with a fixed retainer, you can get a lot of tartar deposit there, and over time that can create gum problems, periodontal problems, and that's something that you want to avoid. So personally, I don't have a fixed retainer, but I know colleagues and I know friends and patients who love it. For me, I'm pretty responsible about wearing my retainers. Right now I wear a night guard on top because I grind my teeth at night, and my night guard serves as my upper retainer. On the lower, I have a Hawley retainer that I wear, and I wear it about 2 times a week. It's been a while since I finished my orthodontic treatment. When I first finished, I wore my retainers full time for a whole year. Most patients don't have to wear it for a whole year. Probably 6 months is suffice, but it really depends on a person-to-person basis. I mean, I know some orthodontists that will tell their patients to go straight to nighttime right away. The research findings I have found say that 4 months is the minimum amount of time that you can go straight from active treatment to nighttime wear, and that's because the periodontal ligaments take about 4 months for them to restructure. And so I advise my patients to wear their retainers full time at a minimum for 4 months, and then they can try to wean themselves a little bit and go to nighttime. I advise nighttime wear for the first year and a half, 2 years, and then you can decrease your retainer wear as needed to no fewer than 2 times a week forever. Let's talk about why you have to wear it forever. Well, your teeth have a tendency, your teeth are a living thing just like the rest of your body, and they have a tendency to move and shift just like the rest of our bodies, right? So our hair changes, our bone structure changes, our skin changes, everything changes. And so if you want to look good, you want to maintain your correction and your alignment, then it stands that you should also maintain it by wearing a retainer. And it's only a hassle at the very beginning when you're done, but after a while, after 4 to 6 months, you're wearing them at night anyway. If you just pop them in before you go to bed, it's really not that big of a deal. It's like brushing your teeth in the morning, right? Another reason why you want to wear your retainers is because your teeth have memory. If you've just spent the last year working out, getting into the best shape of your life, you have to keep maintaining your exercise routine or your good eating habits in order to stay healthy and to look good. So your teeth are the same. If you've just spent the last year or 2 years going through clear aligner therapy, going through braces to straighten your teeth and to fix your bite, it also makes sense that your teeth will want to slip back to how it was. And so that's why it's so important to maintain that. It's like getting good sleep, getting good exercise, and eating right. If you want to look good, you want to stay healthy, then you've got to do all of those things. It's just maintenance, guys, maintenance. So I hope that this video has been helpful for you. If you like it, please give it a thumbs up. Subscribe to the TrayMinder channel, and I'll see you next time. Bye.